Hi everyone, my name is Sydney Wojak, and today for my Business Trends topic presentation, I will be going over dietitians and nutrition support. So what exactly is a nutrition support dietitian and what do they do? Well, it's a dietitian that's involved in a specialized practice primarily regarding enteral and parental nutrition. And this is where a patient in a critically ill state needs either enteral or parental nutrition for total nutritional needs. The difference between the two is that enteral nutrition is where a feeding tube is fed through the mouth, the nose, or into the abdominal wall, into the stomach, duodenum, or jejunum, providing total nutritional support to the gut. If a patient does not have a functional GI tract, they require parental or IV-based nutrition where nutrition is fed through a vein, primarily composing of dextrose, amino acids, and lipids, making up carbohydrates, protein, and fatty acids. Some dietitians who specialize in nutrition support can also work with pediatric patients and specialize in working with this population if this is the type of patients that they want to work with. Also, multiple healthcare professionals, including registered nurses and physicians, must also be knowledgeable in this field as well. In order to become a registered dietitian, one must complete a bachelor's degree in nutrition and dietetics from an ASEN accredited program at a university. And upon graduation, they must receive a verification statement from their DPD director. After that, the student must complete either an ASEN accredited dietetic internship or an ISPP, or an individualized supervised practice pathway. Both require a minimum of 1,200 hours of supervised practice, but the difference between the two is that ISPP is where the intern must find their own preceptors and rotation sites to complete their hours, while an ASEN accredited dietetic internship program at a university or at another facility already has the rotation sites and preceptors set up for the intern. After completing the dietetic internship and receiving a verification statement from their dietetic internship director, the student must pass the Commission on Dietetic Registration exam in order to obtain their licensure to become a registered dietitian, as well as complete continuing education credits every year. Specifically, though, in order to become a nutrition support dietitian, one must pass the National Board of Nutrition Support Certification exam in order to be certified to work in the specialty. So, according to the Bureau of Labor Statistics, the median pay for a registered dietitian in 2018 is $60,370 per year, and the median pay per hour is $29.02. The job outlook between the years of 2016 to 2026 is about a 15% increase for a registered dietitian. Specifically, though, dietitians have a high job increase because they not only work in hospitals, but they also work in outpatient settings, dialysis centers, and also for home health agencies as well. Specifically, though, for an infusion nutrition support dietitian, they can earn on the low end $53,363 and on the high end $81,728. And this all takes into account basically whether the dietitian works in a hospital or an outpatient setting. Also takes into account how many years of experience they have in this field and also where they work at geographically as well. To become a nutrition support dietitian, one doesn't need a specific necessary amount of experience, though if you look up jobs on LinkedIn or Indeed, they'll require at least 3 hours or 3 years of experience. To obtain a CBNS certificate is actually a plus for someone going into this field because this actually can help them earn at least 5 years of continuing education hours. And also, if you join the DNS Academy Practice Group or the Dietitians and Nutrition Support Academy Practice Group, this is actually a great opportunity for a student to network with other dietitians in this field if this is what they're interested in doing, because they can increase their job opportunities for this field as well as network with other dietitians and help build their job experience if this is the type of field they want to go into. Most nutrition support dietitians primarily work in a hospital as a clinical dietitian, though some can mainly specialize within their field in an acute care, long-term acute care hospital, as this is where most critically ill patients are. If nutrition support dietitians choose not to work in a hospital, they can also work for big nutritional companies such as Nestle or Abbott Nutrition, as these are the primary companies that provide enteral nutrition and also some parental nutrition formulas for hospitals, but also parental nutrition formulas can come from pharmacies as well. And so from these main companies, the dietitian can either work with them for a research-based opportunity, or they can provide the registered dietitian grant money, or they can choose to work in a sales-based position where they're selling these products to clients and they're selling them a lot of these products for nutritional information, also for nutritional needs for the patient. So I specifically chose this topic because this is primarily the type of area that I really want to work in after I graduate, because it's what I'm very interested in. And I also noticed that when I did my clinical rotation and I had to calculate enteral and parental nutrition prescriptions during my clinical rotation, I realized that it required a lot of math and scientific-based principles, but also it required a lot of critical thinking, which I actually enjoyed a lot because I actually like to be challenged intellectually. And I also noticed that when calculating enteral and parental nutrition prescriptions for patients, it requires a lot of medical terminology, a lot of medical nutrition therapy, and a big understanding of physiological-based principles and anatomy, because you first have to determine whether the patient needs enteral or parental nutrition if they have a functional GI tract or not. You also have to take into account their medical history. You also have to take into account what the rate of administration is going to be, the route of it, and also specifically what macronutrients are going to make up that formula as well. These are my references, and I want to thank you so much for listening to this presentation.